Hello, this is Brandon Wiley here with Physical Therapy Connections. Today we're going to be doing a video in the series of differential diagnosis. Specifically, we're going to be looking at plantar foot pain, the bottom of your foot, and more specifically, plantar fasciitis. So there are the three most common causes of plantar pain or pain at the bottom of your foot are plantar fasciitis, plantar neuropathy, and tarsal tunnel syndrome. But for today, we'll just be talking about plantar fasciitis. So you might be wondering what plantar fasciitis is. Plantar fasciitis is plantar fascia is a tough tissue right underneath the foot that kind of stretches from the heel down to the toes. When it gets irritated, it gets swollen, it can cause a lot of pain, specifically in the spots of origin and insertion. So it'll cause, again, heel, toes, or maybe even the arch of the foot. So what causes this plantar fasciitis? Causes of plantar fasciitis are many, but the two most common are either prolonged bouts of standing on a hard surface or change in walking or running habits. Maybe you went on a long run or a long hike that you don't normally do. That can kind of trigger some of this irritation in the bottom of the foot. The symptoms of plantar fasciitis, as we were talking about earlier, are kind of the pain in the arch, heel, and or toe of the foot. What can cause what you might also see is specifically the pain will gradually get more the more weight bearing you do, and you might have a lot of pain after prolonged bouts of not bearing weight, such as sleeping. You sleep, you wake up in the morning, try to put weight on that foot, and you get that immediate shooting pain, kind of bottom of the foot, heel area. Lastly, for treatment for plantar fasciitis involves massaging the bottom of the foot, maybe massaging some of the calf, balance training, strengthening training of both the lower extremities and the intrinsic or the muscles within the feet. If you have any questions about that, feel free to contact us. Otherwise, you might try loosening your bed sheets. You could try massaging the bottom of your foot or the calf itself, and then try some easier balance exercises. If you have trouble coming up with specifics or you've tried these and they're not helping, feel free to come to PT Connections so we can try to help you along, maybe make sure to help get rid of that plantar pain. So this has been another video on differential diagnosis. If there is any diagnosis, whether it be back pain or something specific that you really want to see, feel free to comment in the sections below and we'll try to address it when we can. Thanks.